Good afternoon, everyone. Bonjour tout le monde. Today, we mark 10 consecutive days with no confirmed cases of COVID-19 in New Brunswick. We now have 114 of 118 reported cases recovered from their illness, a recovery rate of 97%. And there is now just one patient in hospital with COVID-19. Je suis heureuse d'annoncer qu'il n'y a aucun nouveau cas de COVID-19 à signaler au Nouveau-Brunswick aujourd'hui pour la 10e journée consécutive. À l'heure actuelle, 114 des 118 personnes ayant contracté le virus sont rétablies, soit au taux de rétablissement de 97%. Il ne reste qu'une seule personne du Nouveau-Brunswick hospitalisée pour une infection à la COVID-19. We are not declaring mission accomplished. In fact, we are expanding our mission. So today, I'm announcing a further expansion to our testing protocols to ensure we are identifying any COVID-19 case that may appear in our province. Aujourd'hui, j'annonce que nous élargissons encore davantage nos protocoles de dépistage pour nous assurer de trouver tout cas de COVID-19 qui pourrait survenir dans la province. It is crucial that we do more testing at this stage with a broader range of symptoms to maintain the level of testing that we have been doing thus far, and thus informing our information and data to make good decisions moving forward. As we learn more about the COVID-19 virus and how its presence is shown in the human body, we will ask New Brunswickers to be watchful for a new range of symptoms. 2 weeks ago, I announced that testing would be recommended for anyone who observes 2 or more of the following symptoms: fever above 38 degrees Celsius, a new cough or worsening chronic cough, sore throat, runny nose, and headache. Today, we are adding the following symptoms to that list: signs of fever, such as chills, a new onset of fatigue, a new onset of muscle pain, diarrhea, loss of taste or smell, in children, purple markings on the fingers or toes. If you or anyone in your family has experienced 2 of these symptoms, please call 811 and follow the directions. With the exception of the one for children, you only have to have the one symptom for the purple toes and fingers. Il y a 2 semaines, j'ai annoncé que je recommandais aux personnes présentant au moins de 2 des symptômes suivants de subir un test de dépistage: une fièvre dépassant 38 degrés, une nouvelle toux ou une toux chronique qui s'aggrave, un mal de gorge, un écoulement nasal, un mal de tête. Aujourd'hui, nous ajoutons des symptômes suivants à cette liste: une fatigue nouvellement apparue, de nouvelles douleurs musculaires, la diarrhée, la perte de goût ou de l'odorat, et chez les enfants, des taches mauves sur les doigts ou les orteils. Et seul pour les enfants, celui-là, vous avez seulement besoin d'avoir un symptôme pour cet symptôme spécifiquement, les taches mauves sur les doigts ou les orteils. Si vous ou un membre de votre famille présentez 2 de ces symptômes, veuillez appeler le 811 et suivre les consignes. You may be referred for testing and will be asked to self-isolate until your test results are known. For children displaying purple markings on their fingers or toes, testing will be indicated even when none of the other symptoms are present. Si un enfant de taches mauves sur les doigts ou orteils, il faudra le faire tester, même s'il ne présente aucun autre symptôme. In addition, your family doctor can refer you for COVID-19 test at any time in their medical judgment if this is warranted. This list of symptoms covers our current knowledge of the signs of COVID-19, but we are learning more about the virus every day. And as new symptoms are confirmed, they will be added to our testing protocols. This expansion of testing will put further demands on our collection sites operated by our regional health authorities and on our microbiology laboratory at the Dr. Georges Dumont Hospital Center in Moncton. But I am confident that we have the resources, the test kits, the medical equipment, and the people to meet this challenge. As has been our practice, some groups will get priority in the testing process. We need to protect the most vulnerable in our society, including patients in hospitals and residents in nursing homes. We also need to protect the people who are protecting all of us, including doctors, nurses, paramedics, and other health professionals, as well as people working in hospitals, nursing homes, and other institutional settings. Giving priority to these groups may mean that we won't be able to process every test as quickly as we would like. I understand that this is a source of anxiety for many of you. Please remember that you can use our secure web portal to access your test results so that you can be informed of your condition as quickly as possible and act to prevent the further spread of this disease. Appropriate testing has been a key element of our success to date, and as our efforts and as has our efforts to control movement across our borders and limit the number of travel-related cases. As we reach the end of the academic year for students at our universities and community colleges, families will be planning to move students home from their apartments or dorm rooms. To ease this process, families coming from out of the province will be able to enter New Brunswick for no more than 24 hours for the purpose of a moving student. They will be expected to self-isolate as much as possible while they are here. They should familiarize themselves with the provincial public health measures such as physical distancing, wearing a community mask before entering New Brunswick. À l'approche de la fin de l'année d'études des universités et des collèges, les parents planifient le retour à la maison de leurs enfants étudiants et leur déménagement de leur appartement ou chambre de résidence. Pour faciliter le déménagement, les familles de l'extérieur de la province pourront entrer au Nouveau-Brunswick pour une période maximale de 24 heures afin de leur permettre de déménager les biens des étudiants. Ils devront s'auto-isoler autant que possible pendant qu'ils seront dans la province. Toute personne qui demeure dans la province pendant plus de 24 heures devra se soumettre aux exigences obligatoires de l'auto-isolement de 14 jours. Toute personne qui quitte le Nouveau-Brunswick pour aller chercher un étudiant dans une autre province devra s'auto-isoler pendant 14 jours, peu importe la durée du séjour ailleurs, et respecter toutes les consignes de santé publique à son retour à Nouveau-Brunswick. They should go directly to the residence, pack up and return directly to their home province. Anyone who stays longer than 24 hours will be subject to the mandatory 14-day self-isolation. For those leaving New Brunswick to pick up students in another province for any length of time, you'll be required to self-isolate for 14 days and follow all public health directives upon your return to New Brunswick. These measures are important tools in slowing the progress of COVID-19, but the most effective means we have is to maintain the practices that have got us to this stage. It means maintaining 2 meters of physical distance from others and wearing a non-medical mask that covers your mouth and nose when physical distancing is not possible. It means washing your hands regularly and thoroughly, not touching your face, and cleaning commonly touched surfaces in your home frequently. These are the things that will save lives and protect our healthcare system, and these are the things that have saved lives and have been protecting our healthcare system thus far. And this remains our overriding objective. Let's continue to work together to get the job done. Thank you. Merci.
Bonjour, good afternoon. Before I begin my update, I would like to recognize that today is the National Day of Mourning. This is a day to remember those who have lost their lives and those who have suffered injury or illness on the job. This year, we remember RCMP Constable Heidi Stevenson in Nova Scotia. We are also keeping all of those impacted by COVID-19 in our thoughts and prayers. Ici, au Nouveau-Brunswick, nous sommes déterminés à rendre chaque lieu de travail le plus sécuritaire possible, même durant cette pandémie. C'est pour cette raison que nous avons gardé plusieurs entreprises fermées pendant la dernière semaine et que nous leur permettons de rouvrir leurs portes seulement quand il sera sécuritaire de le faire. We took measures early on to close New Brunswick's borders, and they will remain closed for the foreseeable future. Today, we are introducing an update to the emergency order that no temporary foreign workers will be permitted to enter New Brunswick. This change will not affect the status of any temporary foreign workers who are already in New Brunswick. Under normal circumstances, we welcome foreign temporary workers in our province. En temps normal, les travailleurs étrangers temporaires qualifiés sont les bienvenus dans notre province. They play an important role in New Brunswick's continued economic growth. Ils jouent un rôle important dans la croissance économique continue de Nouveau-Brunswick. But right now, the risk of allowing more people to enter the province is simply too great. Mais pour le moment, il est trop risqué de permettre à un plus grand nombre de personnes d'entrer dans la province. I spoke with Deputy Prime Minister Chrystia Freeland about this just last night. I appreciated her quick response to my request for a meeting and her willingness to hear my concerns. We are in a good position in New Brunswick. We've worked hard, and so far we have been very successful in containing COVID-19. I am committed to keeping it that way, and I won't apologize for protecting New Brunswickers. I explained to the Deputy Prime Minister that we have approximately 1,500 temporary foreign workers in New Brunswick right now. Like the rest of our population, many are unemployed at this time. I've asked for the flexibility to be able to offer them jobs in different areas of the province, including seafood processing plants, and she's committed to looking into that very quickly. We also spoke about the lobster season, including the current low prices and the market conditions. J'ai discuté avec le vice-premier ministre fédéral, Chrystia Freeland, de la différence entre les marchés de la Nouvelle-Écosse qui vendent des homard vivants et celui de Nouveau-Brunswick où nous transformons et entreposons la homard. J'ai dit que nos entrepôts de congélation sont déjà pleins et que le fait d'ajouter d'autres produits va causer une réduction très importante des prix. It's important to protect our food supply and our supply chain from coast to coast. We know these plants need to keep operating, and we know they want to do it safely. We are committed to working with our processing plants. We know they have a core workforce that can support opening at various capacities. If the seafood industry or our agricultural industry needs more workers, I am counting on New Brunswickers to answer the call to ensure businesses that need workers will have them. We all need to do our part right now to keep our province safe and be part of the solution. Nous n'avons aucun nouveau cas dans les 10 derniers jours. Nous avons présentement 4 cas actifs et une seule personne est en hôpital. As Dr. Russell announced today, we are expanding our testing criteria to ensure we continue to limit the spread of this illness. So far, we have done an excellent job of keeping the virus contained here in New Brunswick, and we are in a position to start our recovery. My thanks goes out to every individual in this province who've done their part to meet the compliance standards and to keep friends, family safe. We are not guaranteed success, however. Our province is surrounded by outbreaks of COVID-19, and we cannot take the risk of spreading the virus amongst our residents. If we begin to loosen the restrictions on our borders now, all of the progress we made so far could be lost. As always, we will continue to monitor the situation. When it is safe to do so, we will once again welcome temporary foreign workers in New Brunswick as needed. For now, this is a risk we should not take. Je remercie tout le monde de suivre les règles de l'ordonnance d'urgence. Si tout le monde continue de respecter la loi, je pense qu'il y aura moins de restrictions dans les semaines à venir. These coming weeks and months will be crucial. We will either backslide or we will continue to cautiously move forward. The decisions we make today will determine our province's future in the face of COVID-19. Thanks to your continued efforts, New Brunswick is on the right track. Let's all keep up the great work. Thank you. Merci.
Merci, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from the members of the media. You have the right to pose your question in the language of your choice. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier, and it comes directly from the Mayor of Campobello and the Year-Round Ferry Committee. Premier Higgs, residents on Campobello are reportedly being turned away at the Lubec border when crossing with any number of same household passengers, and are being told that only cars with one passenger are being permitted through unless they can prove they're going directly to St. Stephen, which, just for reference, is over a 160-kilometer round-trip drive. So it's far from business as usual now, and U.S. Border Protection has said to islanders, we don't have to let any Canadians cross if we don't want to. It's a privilege and not a right. So lack of ferry service, according to Horizon Health, has also deterred a full-time nurse from being hired on the island. So with these issues in mind, should at least an early summer ferry be implemented sooner rather than later? And if so, are there any dates in mind right now?
I will look into the actual date when that ferry will be implemented. I did speak of this last week, but I don't have a date. But I think you asked a question, and I deserve an answer to respond to that. So I will have a date for tomorrow on what's projected for that ferry to come back in service. I'll also look into, I'm not familiar with this particular case, but I would like to know the details and look specifically into the requirements that our residents in Campobello are now experiencing at the border, because I'm not aware of any changes. I'm aware that our agreement was that people could move directly through to Canada from going through Maine from Campobello, and if that position has changed or there's any new requirements, it's news to me. So I would like to get the details as well and follow up.
Thank you, Premier. Ms. Hogarth, do you have a quick follow-up?
Sure. I'm just hearing this now from the Deputy Mayor of St. Andrews. If workers are coming from other provinces just for the summer, is that permitted right now as well? Have there been decisions been made on that?
So I guess if I was to, again, we're very conscious of any border activity, so we'd want to know the details of any workers coming into the province. I know there are still projects that are underway here that we have that are under completion, and the protocol for these individuals that are coming to finish these projects is clear. They're being monitored in terms of their isolation requirements. Some are moving back and forth, I know, on a weekly basis. They come, they isolate in terms of their project, and they go back home. But I've asked for basically an outline of all activities crossing our borders, and basically looking at any of them that we can change in that regard to minimize that activity, and also looking at any projects that we're doing, because we want to do projects that are right for New Brunswick and have them done by New Brunswickers, so that we can minimize the traffic across the border at this time.
Thank you, Ms. Hogarth. Thank you, Premier. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell or the Premier. You say parents will be able to come into New Brunswick and pick up their kids from college, but can only stay for 24 hours. But in those 24 hours, can someone from, say, Quebec, Nova Scotia, or Ontario be putting New Brunswickers at risk? And what else are you doing to prevent that from happening?
So the guidance is really around self-isolating while they're in the province. So trying to minimize the time that they're here. I mean, obviously, they should really just be coming to do the moving part and only be interacting with the person who they're moving, and really self-isolate the whole time they're here. And we're recommending 24 hours because, again, we would like them to minimize the time that they're here. So, and if they were staying longer, then we'd want them to self-isolate for 14 days. So again, our goal is to minimize the risks of COVID transmission coming in from outside the province. And again, they have to actually self-isolate, and there is a guidance document that we've shared with the universities and colleges around all of this.
Thank you, Doctor. Ms. Fraser, do you have a follow-up today?
I'm just trying to clarify, though. Wouldn't that be difficult, though, if, say, one parent is coming from Nova Scotia to help their child move back home, and then another parent from PEI, say, is coming to that same home? Like, how do you get them to keep their distance from one another and protect New Brunswickers in the meantime?
Well, again, the guidelines that we've put out really are to give the best protection possible. So people have to use their judgment, make good choices, and minimize those risks. And obviously, the presumption around a parent coming to move their child who's a student would be that they are just going to interact with that person and stay with just that person, and then go to the province that they're moving to. So again, we want people to make good decisions. We want them to have the right information in order to make those good decisions, and I believe the guidance document really does provide that.
Thank you. Thank you, Ms. Fraser. Matthew Roy-Como, l'Acadie Nouvelle.
Merci. Ma question est pour le Premier ministre Blaine Higgs. Le Premier ministre du Canada, Justin Trudeau, a dit hier qu'il travaillait avec les provinces pour soutenir leur plan, le plan des provinces, pour mieux payer les travailleurs essentiels. Il a dit qu'il aurait des nouvelles à ce sujet-là très bientôt. Je me demandais qu'est-ce que vous pouviez nous dire là-dessus. Quel est le plan du Nouveau-Brunswick pour mieux payer ces travailleurs essentiels?
So I think that sums it up in many ways, because we are working with the federal government for clarification on what their program covers, their definition of essential workers, and the cap that they had placed on it. So we continue to seek clarification and guidance from the federal government, and that's kind of where we are. And then we'll be presenting that to our COVID cabinet committee and cabinet. Likely in the coming days, but I don't have a definite timeline, but likely in the coming days.
Merci, Monsieur le Premier ministre. Merci, Monsieur Roy. Comment as-tu un suivi?
Oui, sur le même sujet, toujours pour Monsieur Higgs. Au départ, on parlait des travailleurs des foyers de soins. Maintenant, c'est plutôt les travailleurs essentiels en général. Qui aimeriez-vous qui fasse partie là, de cette liste-là et du plan provincial pour payer mieux les travailleurs essentiels? On pense à qui?
Well, I think as we looked at the original guidelines, we basically looked at categories that were currently paying under the $2,500 a month. That was kind of what the federal guidelines had proposed. So that was creating the first list. I think initially, there was discussion about healthcare workers only, and so we're looking across the network to say, how many people are in the system right today that would fall under the category of the federal requirements? How many are certainly going above and beyond what they would normally do in the face of this crisis? And so we want to be fair. We recognize that so many people are coming up to the plate in order to deliver results for New Brunswickers, that it's not easy to pick and choose, and it's a situation where we recognize the importance of each and every individual, and it goes right across the board.
Merci. Merci, Monsieur Roy. Comment? Merci, Monsieur le Premier ministre. Laura Brown, CTV.
Hi there. I'm wondering, either of you, how will you go about tracking the parents that are picking up their students or their kids? And by that I mean, how will you be tracking if they're only in the province for 24 hours or more, and then they'll have to self-isolate for 14 days after that, but how do you track that?
Well, DPS has border measures in place at the borders, and my understanding is they actually take information from the vehicles that are crossing over into the province. And so, again, we're trying to facilitate this type of moving and making sure that it can be done as safely as possible. So again, the guidance document we've provided would have the information in there around the social distancing, wearing a community mask, all the things that you need to do to protect yourself, and obviously minimizing the time that they're in New Brunswick and while they are here, needing to self-isolate. So doing nothing but the actual parts that are involved in the moving and only interacting with that person that they're moving.
Thank you, Doctor. Ms. Brown, do you have a follow-up today?
Yes. I'm wondering where you're at with the decision regarding mandatory mask wearing while out in public. And I'm wondering if that will go to more frontline workers. And by that I mean, I've been speaking to an individual who was concerned he had been pulled over by an RCMP officer, and the officer was not wearing a mask. And obviously the officer had to get within 6 feet of the driver, and he was concerned about it. And I wonder if there's a feeling on whether or not masks will be mandatory, and will it be mandatory for everyone, no matter their profession?
It's a great question, Laura. I think the non-medical masks that we've been talking about for members of the community are strongly recommended, and obviously in situations where people cannot socially distance. So trying to socialize the concept, get it to be something that's that people are more comfortable with culturally, so that anytime there's a situation that they have to come within 6 feet of somebody else, that they have their community mask at hand. We have to provide enough time for people to procure these masks. It's not like they're in supply in huge numbers in terms of procurement. So individual citizens need to be able to have the time to get ready to make that happen. So right now, from a public perspective, from a private citizen's perspective, we are saying that it is strongly recommended that everybody have a community mask so that they can wear it when they're in public when it's not possible to socially distance. So that's for private citizens. For healthcare workers, certainly we have documents that are specific to healthcare workers. We also have documents that include anybody who's going into the hospital. They need to wear community masks as well. So in terms of all of those pieces, it could be mandatory at a later date, but again, at this time, we just want to make sure for private citizens that they have, again, the information they need to make good choices. If they need to go purchase them, then they have that time to do that, and then they have them on hand. And it's about protecting others. And so, again, we have a population in New Brunswick that obviously we have a lot of elderly people. We have people with chronic medical conditions such as heart disease, high blood pressure, obesity, lung problems, and these people are at a higher risk for having complications from COVID-19. So when you're wearing the community mask, you're protecting those people from being at risk for contracting COVID-19.
Thank you, Doctor. Thank you, Ms. Brown. Ms. Brown. Cédric Tivien, l'Acadie Nouvelle.
Oui, bonjour, c'est une question pour le Premier ministre ou Madame Russell. C'est au choix. J'aimerais savoir qui décide des mesures de rétablissement dans la province et en donnant la priorité à quel principe éthique.
Tu répétais la question? Je ne l'ai pas entendue.
Oui, j'aimerais savoir qui prend les mesures de rétablissement, les mesures de déconfinement dans la province et en donnant la priorité à quel principe éthique.
Ah, OK. Alors, c'est un exercice de collaboration au niveau national avec l'Agence de santé publique du Canada. Tous les médecins hygiénistes en chef de chaque province et territoire pour avoir des discussions sur les critères, sur les principes qu'on peut utiliser dans chaque province individu, comment les appliquer au niveau de l'information qu'on a dans notre région, dans notre province, sur les nombres de cas, la manière de transmission qu'on voit. Et alors, tous ces principes, toutes ces discussions ont pris place au niveau national. On a pris toute cette information et on a discuté avec nos équipes ici au Nouveau-Brunswick de santé publique et tous nos experts, nos épidémiologues, nos médecins hygiénistes dans les régies. Alors, toute cette information était mise dans des rapports avec le système de santé et ça, c'était présenté au cabinet de COVID-19 et aussi cabinet. Alors, c'est vraiment quelque chose de collaboration mais c'est tout informé par des directives du santé publique, l'Agence de santé publique du Canada, et on prend les principes, les directives et on les applique dans notre province.
Merci. As-tu un suivi, M. Terrien?
Oui, j'aimerais savoir si les informations dont vient de parler Mme Russell sont publiques, si on peut y accéder.
Je les ai pas vus dans un nos plans que nous ont présentés sont publics, puis je crois que toutes les provinces qui ont déjà publié leurs plans sont tous publics.
Merci beaucoup. Merci. Andrew Watt, Telegraph Journal.
Yeah, hi. My question is to Premier Higgs. I mean, it looks like the schools are potentially going to reopen in Quebec. Does this change your position at all on the rest of the school year for New Brunswick?
No, I would say it doesn't. We will continue to evaluate our own situation here and then that will decide if there's any activity. I think the Minister of Education has been clear and that we don't see a short-term window here, would only exist if possible if numbers just stayed where they are now, but it would be likely of a little benefit this spring. I think the Department of Education is focused on getting a very appropriate ability to have e-learning and to be in a situation to do that proactively. So regardless of how long this goes on, we can get our kids learning more and more from home and be in a better position so we don't lose too much of the school year or be well prepared next fall.
Thank you, Premier. Mr. Waugh, do you have a follow-up today?
I do. Thank you. This one's to Dr. Russell. Dr. Russell, we're just around about 13,000 tests done. You've expanded the symptoms. Obviously, some of this is based on new information that you've got, but are you also trying to get more New Brunswickers to show up for testing? Is that part of the plan here?
It's definitely a combination, Andrew. So it's a combination of guidance from the national level and new information that's provided. There is a national testing strategy, again, that we base some of our decisions on. We base it on our resources in terms of human resources and stockpiles. And yes, it's very, very, very important that as many people get tested as possible in terms of maintaining our numbers, because we need to maintain a certain threshold of testing so that the information that we are basing our decisions on are based on really good data and really good evidence. And we can't guarantee that unless we keep the testing numbers on average what they have been or increase those numbers. So this will be an ongoing priority for us.
Thank you, Doctor. Thank you, Mr. Waugh. Morgan Campbell, Global.
Hey guys, this question's for the Premier. Premier Higgs, Ontario is looking to their neighbors to the east and the west of us to determine steps moving forward that would see the rollback of emergency measures. Now, New Brunswick has implemented the new bubble approach. I was wondering what went into that decision and how has it been progressing since it was implemented last week?
So there are so many factors involved in making decisions around restrictions, when to lift restrictions, which restrictions to lift. There are so many different factors involved, from the economy to social determinants of health, mental health, security, safety, poverty, etc., collateral damage from people's health problems that aren't being able to be addressed during all of the restrictions. So every single piece of information that we can use to make decisions around restrictions as they're imposed and restrictions as they're lifted are based on many different factors. For the bubble, this was around decreasing the negative impacts of the isolation that people were experiencing in terms of their mental health. And this was an idea that was borrowed from New Zealand, whereby individual households are considered a bubble. And in the most restrictive phase, when the measures are such that you really can't leave your home unless you're going out for groceries, etc., in that phase, if you're a person living alone and are very isolated, this can be very damaging and very stressful from a mental health perspective. So the idea being that as you move towards a less restrictive phase, having the ability for somebody who lives alone to have another household that they can bubble with would decrease that isolation and those negative impacts.
Thank you, Doctor. Ms. Campbell, do you have a follow-up?
Yes. So infectious disease experts are saying that this is a really neat idea, but there is a possibility that infection could be brought into a house with these types of measures in place. That could mean that two houses would be impacted by the virus. What steps should people take to mitigate these risks?
Exactly. With each of these decisions, there's a balance of pros and cons and which risks we're trying to mitigate and what protective factors that we can have at the same time. So ideally, if somebody is going to bubble with another household, ideally, each household should not be leaving the house except for essential things like groceries, and that's how you're going to minimize the risk of anybody getting COVID-19 and bringing it into the household. Obviously, the risks increase if you are bubbling with somebody who has medical conditions like obesity, heart disease, COPD, high blood pressure, lung problems, and is elderly. So if they have any of those issues and they're at higher risk, if they are immune compromised, then obviously any other steps that you can do to minimize the risks in that household are very, very important. So obviously, if you are combining two households for the reasons of decreasing that isolation factor and the impact on mental health, that's one thing. But yes, it does increase the risk if people are going outside the home for things other than essential things like groceries. So we do recognize that there are some benefits and to offset some negative impacts. And yes, there can be extra risks introduced if you don't take the other things into account, like not leaving the house unless you're doing something essential. So obviously, if you have a family member or a household member who has chronic diseases or is immunocompromised or is elderly, it would be better, and ideally, they would only be sharing another household with people who are not having to leave the house for things other than essentials like groceries.
Thank you, Doctor. Thank you, Ms. Campbell. Michel Corriveau, Radio-Canada.
Merci, Bruce. Ma question est pour Dr. Russell. Dr. Russell, il y a des gens dans des petites entreprises qui étaient fermées et qui nous ont confié qu'elles comptaient ouvrir depuis l'annonce des mesures de vendredi dernier. Donc, j'aimerais savoir, avec les nouvelles mesures, est-ce qu'il y a plus d'entreprises qui peuvent ouvrir les portes et si oui, lesquelles et sinon, pourquoi?
Alors, dans notre plan, c'est des phases où certaines entreprises peuvent ouvrir au commencement et il y a certaines entreprises qu'il faut attendre pour la prochaine phase. Alors, dans chaque partie de le plan, ça décrit le type d'entreprise qui peut ouvrir et les dates de 2 à 4 semaines entre chaque étape. Et nous, maintenant, avec ONB, on fait des rendez-vous avec des gens pour engager les entreprises, pour leur dire comment que vous pouvez ouvrir quand la date s'en vient, qu'on va annoncer les prochaines étapes. Pour préparer maintenant, le plan maintenant, c'est pour aider les entreprises avec des directions, des critères, des principes qu'il peut appliquer maintenant pour se préparer éventuellement à ouvrir. Et on parle avec des associants de chambres de commerce dans chaque région. Alors ça, c'est du travail qui est très, très, très important pour 2 raisons. Une, il faut que ça soit sécuritaire, la manière qu'ils ouvrent, sécuritaire pour les gens qui travaillent là et sécuritaire pour les patrons. Alors, partager l'information, c'est très, très, très important pour qu'ils puissent ouvrir dans une manière très, très, très sécuritaire.
Merci, docteur. Merci, M. Corriveau. As-tu un suivi cet après-midi, M. Corriveau?
Oui, merci, Bruce. C'est juste une précision, Dr. Russell. Donc, j'ai compris qu'il y avait des entreprises, j'ai vu ça dans le plan à certaines étapes, et les bars, ça s'en vient en dernier. Et à l'heure actuelle, dans la première étape, on a mentionné les golfs et les marinas, par exemple, mais à l'extérieur des golfs et des marinas et ces affaires-là, est-ce qu'il y a d'autres entreprises maintenant qui peuvent ouvrir leurs portes?
Seuls qui peuvent être ouverts maintenant sont ceux qui ont été annoncés vendredi dernier. Et pour les prochaines étapes, il y a une liste qui décrit toutes les autres choses qui peuvent ouvrir dans la prochaine étape. Et ça, c'est l'intention maintenant, c'est pour donner la chance à toutes les entreprises sur cette liste-là de se préparer maintenant.
Merci beaucoup. Merci, M. Corriveau. Jacques Poitras, CBC.
Hi, this is for Premier Higgs. I spoke to a blueberry farmer this afternoon who uses foreign workers. He's tried to hire locally. He's not sure if he'll be able to get any existing foreign workers to come over to his farm. He says if he can't fill 24 positions in the next couple of weeks, he's ruined for this season and probably for next season as well. What do you say to him?
Well, I would say that, we will work with him to identify, I guess, other workers that could work in his facility. But I would say to him and other New Brunswickers in the area particularly, or in any area of New Brunswick, if there ever was a time that people were needed to step up and be part of the solution and help protect our borders and help continue our record of health and safety operations here in New Brunswick, then now's the time. So we're looking for people to continue what they've been doing so far, not only following the compliance rules, but helping each other be successful. And right now, as we move into this next phase, we're looking at moving into an economic phase so we can restart New Brunswick in the new way of managing through our pandemic and following the public health rules. But we need everyone on board to help us do that. And I'm sure there are lots of people that can do that.
Mr. Poitras, do you have a follow-up?
I do. I'm wondering if all four party leaders on the all-party committee supported this decision.
So as you know, in terms of a cabinet committee and how that works, we have a situation where we discuss the issues and then we come out of a decision with a path forward or not progressing, depending on what the item is. In this scenario, we came out with a path forward that it was the best thing for New Brunswick to actually not have the number of foreign workers coming into here as would be the case. Cabinet is a confidential process. In this scenario, we also focus very much that there are 1,500 foreign workers and in our province right now, many of them unemployed. I made reference to that in my talk this morning. So we asked the federal government, my discussion last night with the Deputy Prime Minister Freeland was, can we have flexibility here to move these workers around to help? So that's one source. And then, of course, the other source is how we actually move in a direction to get people in New Brunswick to be part of the solution as well.
Thank you, Premier. Thank you, Mr. Poitras. Silas Brown, Global.
Hi, Premier. I'm wondering if you can walk us through the calculation here where we have, on one hand, parents being allowed from outside of the province to enter in to help children move. But on the other hand, we won't have temporary foreign workers coming in. Obviously, one group would remain here and be here for longer, but there's still the risk of transmission really from anybody entering from across the border. So can you walk us through that calculation to allow one group to come in and not another?
Well, I think everything, as Dr. Russell said, it is a calculated risk, and what are the options? If it's a case where a student is required to move out of their dormitory or out of the university, we've seen this from our province and students moving back home had to go into another province and come back. There's a very clear path of what they're to do while they're here, and as Dr. Russell pointed out, our security, public safety officers do take note of who's coming. They do take note of the time they're here, and they do have a contact information to follow up on that. I think that in the case of the temporary foreign workers, it's quite a different scenario. We have a situation where we do have the ability to offset that labor force, and this is a case where why would we take additional risk by bringing not only people from across the border but from other parts of the world at this point in time when New Brunswick is kind of an island unto itself right now. So why would we take an unnecessary risk in that regard when we have, especially with so many people unemployed in our province at this stage as a result of COVID-19, and so many people that have demonstrated a willingness to help us get back into a recovery mode? Why would we not take advantage of that and minimize the risk of bringing someone in, not only from another country, but another place in the world?
Mr. Brown, do you have a follow-up?
Yeah, you sound quite optimistic that some of these positions that are normally filled by temporary foreign workers will be able to be filled by either ones who are already here or New Brunswickers. But there's a reason why people depend on foreign workers for a lot of these positions. If this doesn't work, if we see people like the blueberry farmer that Jacques mentioned, who ends up in a really bad position over the next several months, would the province look at stepping in with some sort of aid package to help people who are struggling with the lack of temporary foreign workers, or are you just going to hope that we here in New Brunswick can fill that labor market?
Well, I am optimistic because I have seen people across this province, as they've said, step up to the plate and make a difference in where we are right today in this situation. I've also had communities, initially before we started movement around the province, we had different communities from different parts of the province that say, well, we don't want to have movement in our province. We don't know that we even want New Brunswickers moving around our province. So we've kind of overcome that hurdle. So these same communities, could be in a position right now that say, wow, if I can find people locally to work in my plant and get started, that is safe for my community, it's safe for my operation. We've seen plants that have started up in other parts or running, particularly processing plants in other parts of the country that, it is a close contact type of operation that requires very strict adherence to the public health requirements. And we want to ensure that we have the best possible chance for success. So yes, I am optimistic that the people of this province will once again demonstrate their willingness, their ability to maybe go out of their comfort zone or to step up, because we need them. We need to continue working together to ensure that we have a successful outcome and it continues to be successful.
Thank you, Premier. Thank you, Mr. Brown. Adam Harris, Telegraph Journal.
Thanks, Bruce. Question for the Premier. Premier, you talked about potentially also not going ahead of the spring lobster season. Is that still going ahead now?
I would guess it likely will. In my discussion last night with Deputy Prime Minister Freeland, we discussed that there are nuances here in Atlantic Canada, and I appreciate that in the case of Nova Scotia particularly, who are looking to restart their live lobster market to China and other exports. In the case of Nouveau-Brunswick and the island to a great degree, most of our lobsters are all processed lobsters, and so they would supply the processing plants that are at this point, full in inventory. So my question and concern was that the markets are very limited. The supplies are more than adequate because our freezers are full. And so is the right solution to try to build more freezers in a period of time that, is a limited window? Or is it to try to say, well, okay, will we start up? And right now I would say that DFO will likely maintain the season as it's planned. That's why our focus is, okay, we'll protect our border here in New Brunswick, but we will work with producers and processors in order to find, workers that will be part of their solution. And I think it's also important to recognize that many of the plants have a base number of employees that are able to start up their plants and able to work their plants at different or varying degrees of capacity. So I think we all need to find a solution here, and the solution it's trying to get people back to a norm. And at the end of the day, as we work together, it's also having a province that gets back to a norm as much as it can. So, we can continue to function as a society under the new rules.
Thank you, Premier. Mr. Harris, do you have a quick follow-up?
Yes, please. I got a question for Dr. Russell. Dr. Russell, did you advise the Premier to stop the flow of temporary foreign workers into the province? That directive hasn't been given by the country's chief medical officer, and the feds have put in rules to see temporary foreign workers self-isolate. Do you agree with today's move?
So that's a government decision, and so my job is to provide recommendations around risks. And obviously, we do know with the pattern of transmission that we have currently in the province and our low numbers that the risk remains for cases to be imported from outside of our province. And so that's why all the information from a public health perspective around what we should be doing right now in terms of moving forward is continuing to make sure that everything that we can do around our borders is done. But again, this was a government decision, but in terms of highlighting risks, our borders right now are the risks.
Thank you, Doctor. Thank you, Mr. Harris. Nicolas Steinbach, Radio-Canada.
Bonjour, cette question est pour le Premier ministre Higgs. Monsieur Higgs, est-ce que vous avez, concernant l'interdiction d'entrée des travailleurs étrangers temporaires, est-ce que vous avez consulté l'industrie de transformation des fruits de mer? Il semblait plus nous dire qu'ils auraient préféré une solution de tester les travailleurs, tous les travailleurs d'usine, au lieu de bannir les travailleurs étrangers temporaires. Pourquoi ne pas avoir testé tous les travailleurs d'usine au lieu d'interdire donc les travailleurs étrangers temporaires.
So there were various discussions that have been held over the last few weeks in relation to the processors, the market, the storage that's there, whether there was a fishing season. That's why we had initially spoke about delaying till May 15th. But then it became more evident that there wouldn't necessarily be a better market because there isn't any real sales opportunity for the outlet of the produce or from the processing plants. So in the idea of discussions, so there were mixed opinions, but at the end of the day, the risk of keeping our New Brunswick citizens safe falls right here. It falls with the recommendations that I get from Dr. Russell and her team, and it falls with my colleagues and the Cabinet Committee as we discuss what are the risks and can we mitigate them. So this isn't about a case of, well, could we do something to make it safer by the 14-day isolation? Sure. But could we eliminate the risk altogether by providing alternate sources of employment and alternate sources of workers and doing that through people that already are here in the province? And so when you look at the least risk, it was a pretty straightforward, easy decision.
Merci, M. le Premier ministre. M. Steinbach, as-tu un suivi cet après-midi?
Oui, rapidement. Vous répondez quoi, M. Higgs, aux propriétaires d'usines de transformation qui nous ont dit nos travailleurs étrangers temporaires sont déjà dans l'avion? On nous dit que des travailleurs mexicains sont déjà en route pour le Nouveau-Brunswick. Vous leur répondez quoi aujourd'hui à ces propriétaires d'usines?
Well, actually, they're not, because they weren't scheduled to leave until tomorrow. And so they're not on a plane coming here at this point in time, the ones that I'm familiar with. And I think there were about 175 in this particular situation. In total, we bring in about 600, and they stage in different periods of time, which we'll be tracking and monitoring our options in that case. But, you know, this is a new day. We're on track to, you know, protecting lives here in the province. We're on track to protecting a safe and effective startup of our province. So it's kind of like in the situation we've had right from the beginning. It's short-term pain for long-term gain. Can the processing plants operate? Yes, they can. Do we have adequate workers here in the province that could help and run these plants and work with these processors? Yes, we do. So let's find a solution together. It's about everybody, as I've said repeatedly today, stepping up to the plate, putting New Brunswick first, and putting our ability to recover in a way like no other province has to date. And we're on that track. Let's not lose it. Let's stay focused. Let's keep our community safe. We know how quickly we can lose this, but as I'm committed, as my colleagues are, as Dr. Russell is, we are going to do whatever we can to protect the citizens of this province.
Merci, M. Steinbach. Merci, M. le Premier ministre. That concludes today's update. Thank you very much. Voilà la fin de notre mise à jour. Merci beaucoup.